Well, good evening, everyone. It is June 26th, Thursday, June 26th, 2025, and we would like to welcome you this evening. It's 7 p.m., and we are here to have another great educational webinar. But first, before we begin with our webinar, HFA and I would like to thank our wonderful sponsors, Sanofi and Takeda, for allowing us to present and give you all these great educational opportunities. So thank you to Sanofi and Takeda. So without further ado, I would like to welcome the great dental care oral extraordinaire, Jill Foley with Cascade. She has a wonderful presentation for us, and she will be talking about why oral care matters. And so I will step back and give Jill the spotlight, and I cannot wait to hear what she has to share this evening. So Jill, take it away.
Well, boy, thank you, Robin. That was really quite the introduction. I hope I can stand up to that. We'll see. But anyway, I just want to tell you, Robin, thank you so much for inviting me to do this, and to the Hemophilia Federation of America. Thank you for allowing me to be a presenter. Also, I want to give a shout out to my coworkers and my friends at Cascade Hemophilia Consortium in Michigan, where I work. They are so supportive, and I'm just grateful for them. And it's just an honor to be able to work with two organizations like the Hemophilia Federation of America and Cascade Hemophilia Consortium, who just really love and have such passion for our bleeding disorder community. So thank you very much. And then I also want to say welcome to all the viewers, and I am very excited to be here. I absolutely love to talk about teeth. I have been a dental hygienist for a long time. And then later in life, I also became a registered nurse, and I actually was able to find a job where I could use both licenses. So I get to be a nurse and talk about teeth. So how great is that? Life is good. So anyway, thank you for being here, and I hope that I can just give a couple golden nuggets of information to you to help you with your oral care, and just make it so that your mouth is much more healthier. So we'll go ahead and get started. So the title of the presentation is Why Oral Care Matters, and I do not have any disclosures to report. So the goals of the presentation tonight are going to be to describe the risks of poor oral care, to provide guidance on maintaining good oral hygiene, to provide guidance for preparing for dental procedures, and to promote working with your care team to minimize risks to prevent bleeding complications. So I do want to give you one spoiler alert, that there is kind of a yucky slide on here, because after all, we are talking about teeth and mouth. So if you are a little squeamish, I'll try to prepare you when it comes to it, but I think it's a very effective slide, so just bear with me. So dental education for patients with bleeding disorders, why? Why do you think that we even can't talk about dental care for patients with bleeding disorders? One thing about working in hematology, it's just been, I feel like hematology is so far ahead of most specialists, in that we actually do talk about dental care, and dental care is needed. Usually, when you go to like a neurologist, they don't talk as much about dental care. When you go to a pulmonologist, they don't talk as much about dental care. But hematology, especially with bleeding disorders, we actually do. And I think every body system, we should be talking about dental care, because the mouth is right in the center of everything. So there is a good reason why we really do focus in on dental care. So when I'm at camp, I usually go to Camp Bold Eagle in Michigan here for our children with bleeding disorders and their families. And I get to do dental talks with these children, and it's so fun. And one of the things that I do that I love is to give everyone a hand mirror. And so I asked them to actually look at their mouth. And I don't know if any of you have actually spent some time actually looking inside of your mouth. Your mouth is it's just an amazing area in your body. And so I asked them last time if they would just look at the colors inside of their mouth and just tell me the colors of the mouth that they see. And so some of the kids would yell white, and of course some of them said yellow because they didn't brush their teeth that day. And some said black because we had a few patients that had really bad cavities, lots of cavities. Some said silver because they maybe had some stainless steel crowns or some older fillings. And then we got to the color red. And that was the color I really wanted them to see was, look at all of the red and the pink that's in the mouth. We have lots and lots of blood vessels in our mouth, and those are there because in your saliva you have this enzyme that actually breaks down carbohydrates, breaks down sugars. So when you're chewing food, that saliva is mixing with the food and it's already absorbing into the bloodstream through these blood vessels and feeding your body. So, you don't have to wait for the food to get to your tummy for you to digest, right? It starts right in your mouth. And so with these blood vessels there in the mouth, and you can see how red the mouth is, we have a lot of potential for mouth bleeds, which can be of concern for us, for the people with bleeding disorders, and then also mouth and body infection. So let's talk first about mouth and body infections. So your mouth has lots and lots of bacteria in it, and there are good bacteria and there are not so good bacteria in your mouth. And so the good bacteria tend to keep the bad bacteria in balance. And sometimes when our good bacteria gets a little off, we end up with bacterial infections in our mouth. And actually there's this bacteria called Streptococcus mutans and lactobacillus. It's a big word, but they're just little germs that actually cause tooth decay, and they also can cause dental, gingival infections, so gum infections. And then we also have viruses that can get in our mouth. They can cause infections such as like a cold sore, like you've heard of herpes simplex. Viruses can be in the mouth, and funguses can thrive in the mouth also. So if you were to be on like a lot of antibiotics or something that would actually kill some of the good bacteria in your mouth, you can end up with funguses. Or if you have if you're ill, you could get something like thrush, and so that can thrive in the mouth. And all of these bacterial, virus, and fungus infections are of concern. We want to make sure we get those treated, but the big thing that we're concerned with is that they all cause inflammation, and inflammation causes an increased risk of bleeding. So let's talk a little bit about inflammation. So inflammation, I love this picture of the balloons. These little pink balloons kind of remind me of the gums. They are not really full. They're just kind of all nice and tight, and they're not really full, but it's kind of like a bumper pad up against the teeth and the gums. And so this is how your gums should look. They're nice and tight. The blood vessels in there aren't real full. They do have blood in there because they're feeding the tissues, but they're not real full. Okay. So we have a little bit of bacteria that gets in the gums, in the mouth. It's okay, right? We can deal with that. But then a little throughout the day, we have a little bit more bacteria from our eating, and we need to get in there, maybe brush. Let's say we're not able to brush. So then the bacteria multiplies some more, right? So now we have lots and lots of bacteria in there. So the body will actually send more blood to the gums to fight this bacteria, because we have white blood cells in our blood, right? And they're going to send the soldiers in to fight the bacteria. So the gums will become inflamed, and they'll start looking more like this. So you'll have these bright red these blood vessels inside the gums are filled with blood, and they get all inflamed and swollen. So what do you think could happen then at that point? Those blood vessels could break and bleed, and that could cause a bleed. And so that's how we get inflammation in the mouth. We get this increased blood supply into the gums because of the bacteria there. And then those gums get so filled with blood that when you just touch the blood, you bite it, or you touch your gums, or you bite into an apple, they'll just pop and bleed, right? And we don't want that. That's something we don't want. So remember that when blood comes out of the vessel, bacteria gets in. So you have a mouth bleed, you have all this bacteria that grows in your mouth. And so now the bacteria can get into the bloodstream. And I just love this picture here because it kind of shows, like, I think that little car is like a little bacteria that's there's been a break in the blood vessel in the mouth. This bacteria's gotten in there, and now it's going to take a trip. And we have actually found that mouth bacteria does travel through the body, can cause lots of illnesses. This study that I found was actually from the year 2000, so 25 years ago. And so you can see that we've known this for a while. And they have actually in the brain, they have actually done like cultures of brain infections and found that it's actually mouth bacteria in the brain. And then strokes can be caused just from the inflammatory response from being inflamed. Cardiovascular, you can have heart valve issues. We've seen this when I worked in the ICU. People would have dental work done, and their oral hygiene probably wasn't great, and they had lots of mouth bacteria. And when they had this dental work done, bacteria got into their bloodstream and ended up near their heart, and they ended up with a heart infection in the hospital. You can have, joint infections, people with prosthetic joints. The bacteria, when it gets into the bloodstream, it can travel near those joints and build up and end up with an infection there. In the mouth, just in general, gum disease, oral cancer, oral infections, you can just, from all this bacterial growth in the mouth, you can have issues with that. And for women, pregnancy, low birth weight, and pregnancy gingivitis. When a woman is pregnant, the hormones change in her body, and guess what? The bacteria changes along with it, and you can end up with more of an inflammation in the mouth. And there's actually been a link from the inflammation to low birth weight. And then the lungs, for sure. When I was in the ICU working, when a patient had a tube in their throat to help them breathe, every 2 hours, the nurse has to swab the teeth of an antimicrobial rinse so that bacteria doesn't get into that airway, into the lungs. And so we know that, you can get pneumonia from mouth bacteria and even lung sores. They've actually done cultures from those and found that it is mouth bacteria. Skin, you can get the bacterial infection from your saliva on your skin, and then also sinus infections. And I know when we wear masks a lot, which I think masks are a great thing and we need them, but if you wear a dirty mask all the time, you're spitting on that mask and then you're breathing, and you can get that mouth bacteria into your sinuses and cause infections. So you can see that the bacteria, the mouth is just a gateway to the body. So oral bleeds, then remember, when the blood vessel breaks, when those gums are all inflamed and the blood vessel breaks, bacteria can get in and travel through the body, but also blood gets out. And we are concerned of that. For our bleeding disorder community, we don't like blood vessels to break because it takes a little bit longer for them to clot, for us to clot. And so we want to try to prevent any type of bleeds. And so oral bleeds, we can get oral bleeds from traumas. So if you're horsing around with your friends and you accidentally get kicked in the mouth and you end up with a mouth bleed or a lip bleed, or if you're playing sports, right? If your hematologist says it's okay for you to play a certain sport and your parents are, it's okay to play a sport, then that's great, but you should wear maybe a mouth guard or something to protect your mouth, but you can still end up with injuries to the mouth, right? You can get burns in your mouth if you eat something too hot. You can end up with burns, and it can actually lead to a bleed. So you want to make sure you don't eat really, really hot food. And then infections, we already talked about having a mouth infection. You get lots of soreness, lots of inflammation in there, and those blood vessels then can break, and you can get bleeding that way. With dental procedures like wisdom teeth extractions, we can get mouth bleeds, and sometimes even just a simple cleaning. If your oral hygiene, if you're not doing a good job brushing and flossing your teeth, you can end up with lots of bleeding even just with a cleaning. Medical conditions such as like cancer, if you're on chemotherapy, even, bleeding disorders, you can end up bleeding longer. So you can have definitely bleeds with medical conditions, but brushing and flossing, should brushing and flossing make your gums bleed? Very often when I was in the Hemophilia treatment center, and we would do the bleeding assessment tool and ask the patients if their gums bleed when they brush and floss, a lot of our patients would say yes. And I would say, well, do you brush and floss? And they would say no, because my gums bleed. And it's really just the opposite. When your gums bleed, you need to brush and floss more. So, okay, here's a spoiler alert. The next slides might be kind of yucky for you. So actually, both of these patients have a bleeding disorder. patient A and patient B. And so let's say I'm a nurse and I'm in the center at the comprehensive visit with my HTC, and I am asking this patient, do your gums bleed? Which one of these patients do you think is going to say their gums bleed? And I know you're going to say probably patient A, and that's right. You can see that there is a lot of inflammation. I don't know if you can see my pointer here on this, but all along the gum line of this tooth, of this mouth, there's all this bacteria that's growing, and these gums are very, very angry and very inflamed around that margin of that tooth. And those gums just are filled with blood. So when this patient probably even bites into an apple, they're probably going to have blood on their apple. And with bleeding disorders, we don't want to break those blood vessels, right? We want those to be nice and tight and strong. And so you can see with patient B how tight those gums are. They're not bright red, they're pink, because it's kind of like there is blood in there, but there's not a whole lot because there's not infection, there's not bacteria along that gum line. So the gums aren't angry, and those gums are more like a bumper pad around the tooth. They actually help to protect the root and the bone. Okay, so believe it or not, patient A could look just like patient B if they get in there and start brushing and flossing. I spent many years working in the periodontal office, and we would see patients much worse than this even. And they would start brushing and they would floss, and within a week, their gums started looking so much healthier and so much better. So we really don't want our patients to look, especially our bleeding disorder patients, to look like patient A, because you are more prone to getting bleeds. So the trick to avoid to look like patient A is to stop plaque and inflammation in the mouth. And so that plaque, which is the germs, the bacteria, it grows in the sticky stuff called plaque, and it grows right along the gum line of the tooth. And you can see as soon as it starts to grow, the gums start getting red and inflamed because they're angry, and the body's sending more blood to those gums to help them fight that bacteria. And so those gums get very inflamed and angry. And then that bacteria can go down inside of the gums, and it changes and it gets even more destructive, and it can harden into tartar, and you can end up with more bacteria getting down into those gums. And that's what gum disease, periodontal disease is when the bacteria creeps down into the gums, and then the gums start loosening even more, and then you start losing bone around the tooth. And so we want to try to get that before we get that bacteria creeping down into those gums. So that's what the plaque does to the gums. Now let's talk about what the plaque does to the teeth. So here comes the math, and I feel like there's so much math in life, and so we just have to get used to it. So this is our math in the dental world. Sugar plus plaque equals acid. So anything that's sweet that you eat, any carbohydrate really, but the more sugary the worse. If you have bacteria in your mouth like patient A, and then you eat something sweet, your mouth is going to make acid. And I used to tell my kids when I used to clean their teeth, the children, I would clean their teeth, I would tell them that those little germs in their mouth, they love to eat the sugar, and they actually go potty. The acid is the kind of their potty on the teeth, because that's what happens. The germs actually make acid. Okay, and so sugar plus plaque equals acid. And then sugar, if every sugar exposure, every time you eat something sweet, there's 20 minutes of acid in your mouth. So you think about like battery acid, how it can erode like the skin. It can be dangerous to touch it. Acid in your mouth can start eroding, start eating away the enamel on the teeth, right? So let's say you eat something sugary, that's 20 minutes of acid production, then the saliva can help neutralize it. It'll get it to where it's not acidy anymore. Then you eat another thing that's sugary, you have more 20 minutes. So you can have sugar exposure all day and lots of acid in your mouth. And acid with time, lots of exposures, can equal a cavity, which is a hole in the tooth. And so then you've got this hole in the side of your tooth, and you have all of this bacteria growing in there, and it can actually start irritating the gums even more. So that it goes back and forth. You know, if I were a bacteria, the place I would live in the body would be the mouth. It would be the best place in the world because think about it. It's warm, it's moist, it's dark, and there's tons of food, right? It's like this constant buffet that's going on. They can just eat, and there's all these crevices that can hide. And so you really want to try to get in there and get that bacteria out of there. So the way that we do that is by flossing and brushing, so good oral hygiene. And then also we recommend that you see your dentist regularly because the dental hygienist will get in there and clean those areas that you can't always reach. When you brush your teeth, you don't always get every area, right? And you're bound to miss those, and those areas can get inflamed. And so the dental hygienist was really good at finding those areas and then also check for decay, and hopefully there won't be any issues, but get it taken care of if we need to. The other is eating sweets. We need to watch our diet and watch what we eat so that we don't have too much acid in that mouth and end up with more tooth decay and inflammation. So oral hygiene, the recommendations is to brush, this is the ADA recommendations, to brush the teeth twice a day with a soft manual toothbrush or a powered toothbrush. And I really love powered toothbrushes. I think they work great. There's Oral-B, there's Sonicare, they're all great, but I'm with those, you just kind of hold them in place and move them around. You don't have to do the circles or anything. They kind of do the work, but they can be kind of expensive. And so if you can just get a manual brush, the manual brush works great. And we're going to go over how to use that manual brush properly. You do want to use a fluoride toothpaste. And you also want to try to brush for at least 2 minutes. Now, I don't know if you've ever timed yourself for 2 minutes, but it is a long time. That's one of the things I like about the power brushes is they tend to have a timer on them. But, we used to give kids a little egg timer that they could turn over, or now we have these phones, so you can set your time, your phone to 2 minutes, and you might have to spit a few times in between, but just keep on a brushing till it's time because you really do need about 2 minutes to get that bacteria off your teeth. You want to clean in between your teeth, and that means with a floss or a water pick. They have floss picks now and little brushes you can use. Anything you can get between the teeth is good, at least once a day. If we don't floss our teeth, it's like when we get in the shower and we wash the top of our head, the front of our body, and the back of our body, and we forget about our armpits and our whole side. And that's what's happening with our teeth when we don't floss our teeth. And that bacteria you can have really healthy gums on the front and back of your mouth, but the in between can be all inflamed. And that's what we have a lot of patients say, my gums don't bleed when I brush, but they really bleed when I floss. And that's probably because you're not flossing enough or maybe not properly. Eat a healthy diet. So we talked about that with sugars. We want to limit sugary snacks and drinks. And if you tend to get a lot of cavities, you can use a fluoride rinse if your dentist recommends it. And there are some fluoride rinses over the counter that you can buy, and just talk to your dentist about that. If you do have bleeding gums, sometimes dentists will recommend an antimicrobial rinse. And so there are rinses over the counter that you can purchase. And then there's also prescription mouth rinse that dentists can give or recommend. Some dentists would recommend that you don't use an antimicrobial rinse, so I would just talk to the dentist about that. And then also to see a dentist regularly, at least twice a year. You do want to make sure that you get your teeth checked and make sure you can get that clean bill of health for at least 6 months, every 6 months. So I wanted to show you, this is one of my favorite videos from the American Dental Association. This is healthymouth.org, and you can find this right on YouTube, and it just is a really good demonstration on how to brush your teeth properly.
Keep your mouth healthy, it's so important to brush your teeth 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
And I hope everybody could hear that okay. Mouthhealthy.org is a really good resource for dental information. I love that they talked about brushing your tongue because that is really important. Your tongue has lots of grooves and crevices in it, and it can hold bacteria. And so let's say you clean your teeth really well, but you forget your tongue's just going to inoculate. It's just going to spread more bacteria in your mouth. So cleaning that tongue is a very good idea. So now let's talk about flossing. Whoops. Let me see, let's go on the next slide here. Now we'll go.
In addition to brushing twice a day, flossing once a day will help keep your mouth healthy by cleaning between your teeth where a brush can't reach. It also helps prevent gum disease. Wrap about 18 inches of floss around a middle finger with the rest wound around the opposite middle finger. Hold a small amount of floss, about an inch, tightly between your thumb and forefingers, and gently insert the floss between the teeth. Hug the floss tight to the side of your tooth. Rub the floss gently up and down, pressing against each tooth. And remember, get behind those back teeth. There are other products to help clean between your teeth, especially if you have braces or have a hard time holding floss. Always ask your dentist if you have any questions. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
Okay, and I do love that video also because I love how she shows how you wrap the floss around your middle finger and then use these fingers to try to get in there and floss. That's the proper way to do it. Now I do understand there are patients that have hand dexterity problems. They have arthritis, maybe your hands don't move as well, or sometimes it might just be really hard for you to kind of get the rhythm to do that. So those floss picks are really good to use. The only thing is that after you floss with those picks, pull it out and then wipe it off with a Kleenex, and then go into the next spot and then wipe it off with a cleaner spot on the Kleenex, so that you're constantly wiping the germs off that, so you're not just putting the germs into every spot. So I think those floss picks work great and they're very handy. So some other additional tips is I always tell my patients, once again, with a hand mirror, I love the mirrors. After you're done brushing your teeth, when you spit out with water, look in the sink. Is there blood? Do you see blood in the sink? If you do, then get that mirror and look around the mouth and see where that blood's coming from. And then go back, if it's on the brushing surface, go back with just some water and really just brush it again. Rinse it out again, try to get it clean, because remember, the culprit to the bleeding is the bacteria. Now with a bleeding disorder, you're going to bleed longer, but the reason your gums are bleeding is the bacteria, right? So we want to get that bacteria off there. Same with if it's between your teeth, grab some more floss and get in there and floss that area again, just to make sure we get all of that debris off that area, because that bacteria is what's irritating those gums. You do not ever want to smoke anything, and you do not want to use tobacco, chewing tobacco. It's very, very hard on the body, and it's also very hard on the mouth. We see effects from smoking. It just makes the teeth look terrible too. They're just brown and yucky looking. But also, we've seen a lot. I have seen in my practice oral cancers. Especially from like chewing tobacco, where you hold the tobacco, it just really does a number on the tissue. So try to avoid smoking and using tobacco. Always wear a mouth guard. And so when you play sports, if you do get the okay from your hematologist to play certain sports, get out there, use a mouth guard to protect your teeth. We don't want any injuries. They can be pretty bloody if you knock a tooth out. And then also wear your seatbelt. You want to prevent that, protect that precious head, but we also want to protect our mouth too, because we can get lots of bleeding in there from a mouth injury. And then don't forget to wash your hands after you do oral hygiene, after you do mouth care. We get like this little boy in the picture, he's just brushing away, and I think that's so cute and that's great, but you can imagine he's probably got spit in his hand from brushing on that toothbrush. And so you want to put the toothbrush away and then have him use some soap and water and wash his hands, because it's a great way to spread germs. Lots and lots of germs in the mouth. Toothbrush care, rinse your brush thoroughly with water. Just run it under some water when you're done, and then store it upright and let it dry. You can store it in a closed cabinet in between brushes to avoid droplets. You can also leave it out on the cabinet, but one thing that you want to do is try to keep it away from the toilet. I've gone into people's homes and I've seen their brushes sitting on like the back of the toilet. You do not want to do that, because when you flush the toilet, you can actually have droplets go into the air and you can get on those toothbrushes, and we just do not like that on our toothbrush. So set your brushes away. And this picture actually kind of shows, it's a okay picture as long as those toothbrushes are in holes that keep them away from the other brushes. But if they're just a cup and they're in there, when they can actually, those brushes can fall on top of each other, and when those bristles touch each other, they can inoculate. The germs can jump from family to family on those brushes. So it's good to make sure you use a holder that keeps the brushes in their spot, or even just store them in a separate place. Remember that you want to check the bristles, like the doctor said in the video. If the bristles become bent, it's not good. They're not going to work. So you need to get a new toothbrush. I've had patients say, I brush all the time and my gums still bleed. And it's probably because your brush is just not in good working order. Those bristles aren't where they need to be. Don't bite on your brush while you're putting the cap on the toothpaste. I've seen this too, and that'll definitely bend your bristles and the brush won't last as long. The brushes generally last about 3 months. So, you need to change them every 3 months. And I always feel like we get a little gypped when we go to the dentist office, because we need to go every 6 months, and they only give us one brush. We should get two, because every 3 months we need to change. So it's a good idea to have an extra brush and just get rid of that toothbrush. Also, if you've been sick, if you've had a respiratory infection or a sinus infection or a mouth infection, it's a really good idea. After you're done, like you're on antibiotics, get rid of that brush and start with a new one. And then I said that we want to make sure we change those brushes every 3 to 4 months. So now we're going to talk about diet. So diet is huge, because remember the math. Plaque plus sugar equals acid, and acid and time equals a cavity and inflammation, right? More plaque. So if we talked about taking out the plaque. Now we're going to talk about reducing the sugar, the starchy foods. So, and I love food. I mean, all of these foods on here I love, and I eat them. But you just want to do things in moderation. You don't want to do it all day throughout the day and expose those teeth to all that sugar. So like I said, the math, plaque plus sugar equals acid, and acid plus time equals tooth decay. And remember, there's 20 minutes of acid for every exposure of sugar. So if you are drinking a soda pop, okay, you're sipping on it for 2 hours. Think about all of the acid that your teeth are going to be exposed to then. So it's much better to just drink that soda pop and rinse your mouth out with water and be done. And just remember that it's at 20 minutes. That saliva, it takes a while for the saliva to get that acid back up to where the mouth to where it should be. And then also, plaque plus sugar equals more plaque, right? And the plaque irritates those gums. And sorry, there's that gross picture again of patient A. We want to try to avoid that. And I just can't stress this enough to our bleeding disorder patients. We really, really want to avoid our gums to look like this, because this is just a bleed waiting to happen. And you can, by proper brushing and flossing, you can get this under control so that your gums look much healthier. So eating sweets and starchy foods, including sweet drinks. So what do you think is the number one culprit for tooth decay today? I wish I could hear your voices. Um, I'm going to tell you what it is. It was a long time ago, a while ago. It's always been like pop, right? Soda pop. Mountain Dew has the most sugar in it. And I always cringe when people are drinking Mountain Dew, and I mean, you can drink a Mountain Dew, but like I said, don't do it all day. Don't do the dew all day because you'll just have lots and lots of cavities. I've seen this. But one of the number one things that's decaying our teeth today is actually coffee. Where it's a big coffee. We drink lots and lots of coffee, and most of our coffees are deliciously sweet, right? Lots of sweet and sugar and cream, and we're sipping on coffee all day. And so that all day sipping is just causing our pH in our mouth to just be all acid and to cause tooth decay. So another thing are gummies, like any type of gummies. You have gummy vitamins now, gummies, those gummies are very sticky and they stick on the teeth. And so they can stick in the grooves and the crevices of the teeth. And then if they're not cleaned off, they're just going to expose your teeth all day to acid, and you could end up with tooth decay and more gum inflammation. So you want to, after you're done eating sweet things, I want you to have birthday cake on your birthday. Just when you're done, if you can just take some water and rinse your mouth out really well. Just swish around, swish and swallow if you can. And then, believe it or not, you should wait about 20-30 minutes to brush your teeth after you have something really sugary, because that will give the saliva enough time to get that acid out of the mouth to bring that pH up so it's normal. And then you can get in there and brush, because you can actually brush away some of the enamel. Like the enamel starts to break down. If you don't wait till it neutralizes, you can actually brush away some of that. So you want to try to get in there and just wait about 30 minutes. Chewing gum right after you eat sweets is really good. Not sugary gum, but gum with xylitol is very good, because xylitol actually helps fight decay, and it also stimulates your salivary glands to make saliva so you can bring that pH up and get that acid out of the mouth. And so I do like chewing gum because I do like that saliva stimulant. Then also you want to limit your exposures, and I bolded that because that's the main thing. I don't want you to, not going to say you can never have sweet things again, because we want to enjoy life, but we also want to limit our exposures. So the other thing now is we've talked about diet, we've talked about brushing your teeth, and then is to see your dentist regularly, at least twice a day. You want to inform your dentist that you do have a bleeding disorder, and you can tell them, like, do you prophy dose? Do you self-infuse? When did you last infuse? Do you have a port? Do you have an inhibitor? Have you had issues going to the dentist in the past? Hey, last time I had my teeth cleaned, my gums really bled. Make sure that you tell the dentist that, let them know that. Any bleeding, so keep them really informed. Now, we always told our patients here that sometimes the dentist will get really scared when they hear you have a bleeding disorder, which is something we are also working on. We're working on going to the dentist and talking to them about patients with bleeding disorders and all the meds and how we can control the bleeding so you can see these patients. But we always said, if call the Hemophilia Treatment Center if you've got a dentist that is just afraid to see you. And sometimes we would be able to talk to the dentist and tell them, hey, if you work with us, we can get this patient seen. So let's say that you do go to the dentist and you have a cavity, okay? And probably too much coffee or too many gummies or something. And so you have a cavity, and so now what to do? So if the dentist tells you do have a cavity, you want to schedule that next filling appointment about 2 to 3 weeks out, so that you can contact your hemophilia treatment center or your hematologist and let them know when it is. And the hematologist will have enough time to come up with a treatment plan to help prevent any bleeding. So we want to try to have 2 to 3 weeks out. Now, if it's an emergency, absolutely we need to get it done, and we'll try to work fast. But if we can have at least 2 to 3 weeks to get this plan ironed out, make sure that you have enough meds. Remember, sometimes we have to get to the pharmacy quick and get medications to you. So we want to make sure we have enough time to do all that so we can have a safe dental procedure. Also, we recommend that you do schedule after 11 o'clock in the morning. And that's because if you have to have an infusion before you have this dental procedure, that you are able to have enough time to get the infusion. I'm always I admire people that can get up first thing in the morning and tie a tourniquet on their arm and infuse themselves. That's sometimes that can be hard when you're sleepy, and it's best to have a little bit of time. And then also, if you have to have an infusion at an infusion center, we need time to be able to get you to the infusion center and then get you back to the dental office to have your dental procedure done. So try to schedule after 11. And then we also do recommend that you schedule Monday through Thursday, not on Friday, just because hemophilia treatment centers are usually open Monday through Friday, right? And they're not open on Saturday. So if you have a bleed through the night, if you have the tooth done on Friday and you wake up on Saturday morning with blood all over your pillow, which is rare, but if you did, then you'd call the hemophilia treatment center. There probably will be a doctor on call, but it might be a doctor that doesn't know you as well. So we like to be able to have the procedures done so that the hematologist office can check on you to make sure that you're doing okay, or you could call them. Now, I do know that sometimes Friday is the only day you might have off work or something like that, and that's perfectly fine too. But just get a plan with your HTC, find out, hey, if I wake up Saturday and I do have some bleeding, what should I do? What do you recommend I do? Who should I call? So you have that all planned out. And I have this in bold: record the date and time of the procedure. So make sure that you know what day and time your procedure is going to be. The type of the procedure: is it going to be a filling? Is it going to be a root canal? What is it going to be? Or what teeth are going to be involved? Now, I've had, where's this going to be at? I don't know. I think it's going to be the lower left, and I think it's a filling. Then I call the dentist office and it's like, no, it's an upper left root canal. And so if you can try to write down what the procedure is going to be, then you can report this to the hemophilia treatment center, and they'll be able to make a treatment plan that'll be right for that procedure. Then you do want to call that hemophilia treatment center, provide the dental providers, who the dentist is, with their phone number, the name of the procedure. And even if you can say, yeah, I think I'm having a filling on a molar up on the upper, that helps. That does help. And then the date and time of the procedure, when it is. And like I said, it's best not to schedule it right at 8 o'clock, because we might need to have an infusion set up before that. What medications or supplies you have on hand. Also, like, if you do prophy dose, when did you last prophy dose? Sometimes it's really great to schedule those dental appointments right on the day you're supposed to prophy dose, right? So you do your dose and then you go in and have your treatment. So you need to let us know, the hemophilia treatment center, give us that information. If you've had any bleeding in the past with this dental procedure, I had a filling up in that area a year ago and I had an issue there. So let us know that. And then also past treatment used for dental procedures. So, hey, I used my factor and I didn't have any problems when I had a tooth pulled the last time. And so it's kind of good to remind us, to what and what works for you. So I do recommend that you work together. That's kind of a triangular model here. We have the patient on top, and then we have the hemophilia treatment center, the hematologist, and the dentist, and they're all communicating with each other. The patient needs to talk to the dentist and to the hemophilia treatment center. The hemophilia treatment center can then reach out to the dentist, and the dentist can get the treatment plan kind of submitted. And then the hemophilia treatment center can reach back to the patient, tell them what the plan is, make sure the patient has the medications that they need before the procedure, and then we're all set to go for a safe dental procedure. I am currently really working on also having nurses in the centers, because I know not all the centers have dental hygienists. So I think it's a really good idea for the nurses to have like a tooth chart, so they kind of know where in the mouth this is going to be when the patient has the procedure. And so kind of just start to teach them a little bit of dentalese, how to speak that language, because the dentists sometimes they just don't even know. They're just waiting for you to make the treatment plan. So it's just a good communication is definitely the key here for a safe dental procedure. So, the main issue I'd like you all to remember is when you have a dental procedure, call your HTC, but don't call us the day when you're in the chair. That's happened many times, and I think most nurses would tell you that, you have a patient, oh, I forgot to call you. I'm in the dental chair and I need to have a filling. That can be an issue, especially, if you are going to need some factor or something, we need to make sure that we have time. We might need to reschedule that appointment because we do want you safe. We don't want any bleeding or any airway problems from your dental procedure. The Hemophilia Treatment Center, the providers will then look at your bleeding disorder, your severity, your bleeding history, the medications you're on, and come up with this treatment plan. And I kind of have a sample here in yellow is kind of what the letter kind of looks like this. I know all HTCs are different, but we kind of sent a letter that had the plan to the dentist so the dentist knew. And then we also let the patient know what the plan was, made sure they had the medications. If there were any excessive bleeding or swelling, the patient was instructed to make sure that they called the Hemophilia Treatment Center. So just that communication between the patient, the dentist, and the Hemophilia Treatment Center makes for a safe procedure. So another thing, be very, very, very careful when you are numb. If you get dental anesthetic, it can take your lip and your tongue right out, right? You can't feel it. And then you can chew, chew, chew. And when that numbing wears off, your mouth is like hamburger. So be very, very careful not to bite your lip. Remember, lots of blood vessels in there, and you can do it without even feeling. I remember when I was a kid, when I had dental anesthetic for the first time, I just chewed and chewed like it was gum. And I just had so much bleeding in there. And you can imagine with bleeding disorders how bad that could be. So remember that if you are numb, try to keep your teeth away from that area so that you don't, to avoid a bleed. So quickly now, mouth bleeds. Teething. We're going to talk about most patients when these little babies are teething, we don't hardly ever see bleeding. In fact, in my 5 years of working in the Hemophilia Treatment Center, I don't think I ever once had a mom call and said that there was bleeding with teething, although there's always exceptions, right? So if there is any bleeding, we encourage moms to call. If you see oozing or anything that concerns you, call the Hemophilia Treatment Center and they can help you. They might need to have some Amicar maybe rubbed on their gums or something like that if they do have any bleeding. Loose primary tooth. So when a child is losing a baby tooth, the main thing is don't pull that tooth out before it's ready, because those roots will start to absorb. They'll resorb as the permanent tooth is actually coming up, and those baby tooth roots will just start disappearing. And so when those roots get really, really teeny tiny, almost none, then that tooth will fall out naturally. And that's what we want. You don't want to pull that out when there's a big root because it will actually cause more bleeding in that area. So just let it come out. You can wiggle it around, but just don't start yanking on it. Also, you don't rinse or spit after losing a tooth. Now, you can get dry socket. I don't know if any of you have had that, but that's where the clot in the socket comes loose and it exposes the bone and the nerves in there, and it is very, very sore. That clot is actually healing, right? And so you need that kind of in there. And if you spit or suck on something, you can loosen that clot and then you have a lot of pain. Now, I do know I've spoken to many dentists, and in the time that I practiced, we didn't hardly ever see dry socket on a child. That is very rare. But it's just always best to just be safe and not spit. So just have if your child, just have them rinse gently around the mouth after they lose a tooth and open their mouth and let it fall out. But it isn't as common for a child to get dry socket. They can bite on a moist, if it's bleeding, bite on a moist gauze. You can run it under cold water, kind of fold it up and have them bite on that. Or believe it or not, even a tea bag. The tannins inside of a tea can actually cause the blood vessels to constrict. And so we would tell our patients in the dental office, and I've seen studies with black tea, green teas. I think just a regular old tea bag you have in the house, if you can run it under cold water and just have them bite on that, that can actually help stop the bleeding after they lose a tooth or a tooth extraction. Orthodontics. A child gets braces. Generally, there's not much bleeding unless you look like patient A, right? If your gums are just bright red and ready to bleed, I think if the orthodontist just touches those gums, they're going to bleed, right? So that's another reason to have really good oral hygiene, brush your teeth well, especially if you know you're going to get braces. Get in there and start really brushing good. Get those gums healthy before you get those brackets put on. Um, and usually you don't need it, but you do need to watch because the brackets can be really sticky and they can grab your lips and they can rip, they can tear a little bit. So there's wax that you have to put on the braces that really helps so that your lips will slide over the braces. Also, wires can come loose and they can poke into the cheeks. So you want to make sure if you have a loose wire, call the orthodontist right away because we do not want you to have a bleed. And so get in there as soon as you can to get that and then get that taken care of. Remember that if you're the more your gums are inflamed, the more bleeding you're apt to have. And so the same with braces will trap a lot of food and bacteria. So they'll give you little brushes to help you clean, really work on cleaning your teeth good when you have braces. It's very, very important because you can get lots and lots of plaque grown in there. Wisdom teeth extractions, most wisdom teeth need to be come out between 17 and 25 is the normal age. Believe it or not, I actually had a patient one time that was only 13, which is very, very young. When babies tend to get teeth very young, it just continues on. It's like a domino effect. So they'll get the wisdom teeth very young. It was rare, but it does happen. The normal ages is 17 through 25. You do want to coordinate care with your oral surgeon and your hemophilia treatment center. This is definitely a high risk. You definitely high risk for bleeding. You can get bruising, you can get swelling, and so you want to follow the hemophilia treatment centers information and their directions, and also you want to follow the oral surgeons. The main thing is after an extraction at that age, you do not want to suck on a straw. You don't want to smoke and you don't want to spit after you have an extraction because those things can cause the clot to loosen and you could end up with dry socket and be in a lot of pain. So really try to avoid that. Dental restorative procedures, that means like cavities, root canals, dental implants, things like that. Definitely we need, depending on the procedure and your bleeding disorder severity, you need to contact the hemophilia treatment center and coordinate care. Like we said, that triangular between the patient, hemophilia treatment center, and the dentist. So mouth bleeds reviews, there are major and minor bleeds. Mouth bleeds, major bleeds can be a medical emergency. And so what you're looking for with a major bleed is any swelling or bruising of the mouth, especially back towards the throat. If you have trouble breathing or swallowing, that airway is there and we're concerned about that. We don't want any airway issues. So, and then also if it continues to bleed, if you wake up in the morning and your pillow has blood on it, after through the night, it should try to stop bleeding. If it continues to bleed, then you'll want to contact the HTC. And like I said, if you have any airway issues at all, make sure you get into the ER, call 911. Those are very rare, which is good, but we just want to make sure that you are prepared for that. And then the minor bleeds, like any oozing throughout the night, you wake up in the morning, it still might be just a little bit of oozing, that type of thing. Call your hemophilia treatment center because it might be that you need to use maybe some more factor the next day, or you might need to use like some more Amicar or tranexamic acid or DDAVP or something like that to get that to slow down. Also, you can apply cold, cold on the outside if you're swelling, cold in the mouth. The popsicles are really good, although you don't want to suck on them if you've had an extraction. You can, just let them melt in your mouth. But popsicles are great because they are cold. Topical liquid Amicar is great. You can actually soak a gauze in it and bite on that if you've had an extraction or if it's an area in your mouth that's bleeding, just put that gauze right on there. That can help. Just whatever your hematologist recommends, just follow the directions there. And if it doesn't stop, you may want to end up going to the ER. Compression there again, that's why I like that tea bag works good, or a rolled up gauze because you're biting down and putting pressure on it, or even if you have to hold with your finger some gauze or something on that spot, the compression will help from the bleeding. So we have gums that are all inflamed. We have lots and lots of bacteria, and we at the point like patient A where we could break and bleed. So what we're going to do is we're going to work backwards now. So we're not going to break and bleed, and we have all this bacteria. So we're going to get in there, even though our gums are really inflamed, and we're going to brush. And we're going to brush those inflamed gums. Now remember, your gums are probably going to bleed when you brush your inflamed gums, right? But we've got to get the culprit out of there. So we're going to brush our inflamed gums. We're going to get rid of the bacteria. And so we'll rinse our toothbrush out, set it away from our toilet, and set it out in the air to dry. And now we have this inflamed gum tissue. There might be a little bit of blood, rinse out with some cold water. And then we do that a few days, and our gums are going to look like this again. They're going to get nice and pink. And that's what my goal is. I want to see our community, our bleeding disorder community, have nice, tight, pink gums that are less apt to bleed. Because when you have to have a dental procedure, you're going to have a much less bleeding chance that if your gums look like patient B versus patient A. So then what we have is we have like these two young men with bleeding disorders, and they both have just amazingly healthy teeth and healthy smiles, and all is good for them. So remember, healthy gums are less likely to bleed, and you have the power to make your gums, your teeth, and your whole mouth healthy. So this picture here is what we really need to strive for, is to make sure our gums are nice and flat. They're nice and tight, and they're pink. We don't want bright red, we want pink. So you do have the power to do this by really good oral hygiene, by a good diet, and by visiting your dentist. So oral care really, really does matter. So I guess at this point, if anybody has any questions, Robin, if we could.
Sure. So I'm gonna look down in our Q&A. Wasn't this such a wonderful presentation? I am taking notes myself because I think I personally could have some better hygiene tips, especially when it comes to the soda and the sugar. So thank you
Yes,
so much
yes.
for the great information. So I'm going to be sure that I for sure stay on my P's and Q's when it comes down to my oral care.
I'm really glad to hear that, Robin. That's great.
Yes. So Jill, thank you so much for you know, giving us this really great info and these great tips. If anyone does have any questions, I'm going to check down into the Q&A, and we do have a question. So the question is, at what age should I take my child with a bleeding disorder to the dentist for the first time?
Great question. I always recommend around 3 years old, believe it or not. It's always good to have your child go in and take a ride in the chair, right? It's just a fun appointment where, and I just love those appointments. You bring them in with mom or dad or big sister, or just bring them in. They can sit in the chair and go up and down in the chair a little bit. We might show them the mouth mirror. We don't have to actually look in the mouth too much because we don't want to scare them. Just kind of ease them into it. And again, the hand mirror is one of my favorite things. I give my patients the hand mirror. Look at your teeth. Let's get used to looking at your teeth. Show me how you brush your teeth. Yay, you get a new toothbrush. What color do you want? Make it a fun visit for them. And then also make sure you're at home that you are brushing their teeth. And if they have like gag problems, or if they have that, sometimes even a washcloth can help wipe that plaque off their teeth, get them. But I really like age 3, get it young. And then I think most dentists would agree that that's a good time. Just come in and just have a fun time. And then a lot of times they'll come in with mom, and they'll sit on mom's lap, and that type of a thing. So good question.
Yeah, great question. So we have another. So this question is asking, are diabetics more susceptible to gum disease?
Really, really good question. Wow, you guys, this is I almost need a dentist on this or a provider on here. Yes, I would say definitely diabetes. It's all about sugar, right? And so hopefully, if you're following your diet, you're eating less sugar, which is great. But your immune system can be taxed, and so it is really, really wise to do when you have diabetes, have excellent oral hygiene. There again, I had many patients come in with diabetes, and so, but you again have the power to make your teeth and gums healthy by getting that plaque away. The plaque is the culprit, the bacteria is the culprit. So the cleaner you can keep your teeth, the better. And then, follow your diabetes, try to keep your blood sugar stable so your body's not, as taxed. And if you can keep that diabetes under control and then just get in there with good oral hygiene, you should be pretty good. So yeah, great question.
Yeah, these are some really great
Yeah.
questions. Well, I think that might be the two that we have
Okay.
in our Q&A, which the information was so great. I'm pretty sure others were taking notes just like how I was. But
Good.
if
Good.
there are any additional questions, they can for sure reach out to us and we'll get those questions answered from you, Jill, and
Absolutely.
the team at Cascade. Well, we appreciate this time with you and this time that you have given to us with such great information. I would like again to thank Sanofi and Takeda, our sponsors, for this wonderful presentation. And with that, I will give you all back your evening. I hope, Jill, you had a great time with presenting to us, and we had a great time with learning. And so we hope to see you again. My kids are coming in. So,
Yes, definitely.
so
Thank you for having me.
and you have a
I
great
really appreciate it.